Okay, it's 1 o'clock, so I will wish you all a good afternoon again. I'm Jessica Vanderkolk, one of our public information officers for our countywide COVID response, and I will be your MC for today's Calhoun County Joint Information Center. Today is Wednesday, March 16th. As always, our administrative notes. Our unified command team of Kelly Scott from Calhoun County, Rebecca Fleury from the city of Battle Creek, and Eric Pessel from the Calhoun County Public Health Department. As always, our Joint Operations Center and Joint Information Center, goals and information. And we have a robust agenda for today. So we are going to jump right in with Eric.
Thank you, Jessica. Good afternoon to everybody. And I come to you this week with really probably the best news that we've seen in a long time regarding COVID and transmission levels in our community. You can see pretty clearly on this graph on the right-hand side of the slide, the precipitous fall that we've seen over since the end of January to today. And that's basically what we're seeing out in our community right now. Importantly, most importantly, or more importantly, I guess, we also only have 2 individuals with COVID in our 2 hospitals, and that's great news. Next slide. So there's a new dashboard where we've improved our dashboard on the county website, and we've included the new CDC tool that looks at our community risk levels, whether we are in low, medium, or high community level. And the difference being that doesn't just look at the number of cases, it also looks at the number of new admissions per 100,000, and also the number of the percent of staffed beds that are occupied by COVID patients in a particular hospital. And it also still looks at that case rate and puts that all together and gives us a risk level. Right now in Calhoun County, according to the CDC, we are in a low risk, but you can see that on our website, and you can go through and the detail of that and what that means to us individually, whether we're in low, medium, or high. And also we have included this in our school resource page for our schools to be able to keep an eye on what's going on in their community. Next slide. So some of our local statistics that we've seen, it's, as the cases have come down and we've been able to kind of take a breath, we want to look back and see, what do we have in data that kind of tells us our story over the past 2 years. And I think one of the first things is, who is most vulnerable to contracting or becoming a positive case of COVID. And in Calhoun County, at least, the number 1 age demographic to have confirmed positive is our 20 to 29-year-old demographic. And in a close second, it's our 30 to 39-year-old. Those are the ones who are the most likely, had the highest percentage of our COVID positive cases. However, the 2 age groups that was our largest percentage of deaths were our 80 and older population was our largest percent. And our second largest percentage was our 70 to 79. And that's just a good reminder for us all to understand who is most vulnerable with this COVID disease and how best can we protect them as a community and as individuals and as family members as we continue down the pandemic. Locally in Calhoun County, we've had about 67,000 eligible citizens that have completed their vaccine series. That means that they've gotten both the first and second dose of Pfizer, Moderna, or they've gotten 1 dose of J&J. And also, I would say, it's not on this slide, but of those, about 34,000 of those folks have also received a booster. And again, I can't stress enough, and we've said this for over a year now since we've had vaccines out, but to be vaccinated does make a difference with this disease. And I think this graph illustrates that. It illustrates it very clearly. The black line is unvaccinated, especially if you look at the Omicron curve and who that affected the most. And the blue line, the lower line is those that have received their series plus a booster. And that is just who has become infected with the Omicron during that surge. And you can see that very clearly. Also, I would point out that you're 41 times more likely risk of dying from COVID-19 if you're unvaccinated versus somebody that's vaccinated. These are the numbers that we can start to put together on this and hopefully get the word out to those folks that are still on the fence, that are still thinking, nah, I don't really want to get vaccinated. This isn't over yet. There's going to be other variants and strains in our community. And those of you that aren't vaccinated, a vaccine will at least protect you from severe disease, illness, hospitalization, and probably death if you get vaccinated. So, my message to everybody is, if you have questions, speak to your medical provider, speak to your doctor. But in the bottom, in the end of things, get vaccinated if you haven't. Next slide. So MDHHS recently came out with new guidance on quarantine and isolation. It's something with this pandemic. It's a term that a lot of us in public health, we use the term a lot, but a lot of the general public didn't know what quarantine and isolation was. Now we're all experts. So isolation hasn't changed. If you are confirmed positive, or if you are associated with a confirmed positive and you're symptomatic, you need to isolate. And isolate means that you stay home, and you stay home for 5 days. Once your symptoms are resolving or are resolved, then you can come back to work and play and school and all of that. Quarantine, however, has changed. And the guidance now basically says that if you are, if you are a household contact of a positive, monitor your symptoms, test after day 3, between day 3 and 7. We recommend you wear a mask around others for 10 days and avoid unmasked activities with the higher risk of exposing vulnerable individuals. So you'd want to avoid maybe visiting grandma or grandpa at the nursing home. If you're exposed out in the community and it wasn't in the household, then we recommend to monitor your symptoms for 10 days, consider wearing a mask around others, and test if your symptoms develop. And that's a big change from, we want you to stay home in quarantine for 5 days or 7 days or 10 days. So that has changed. That's our latest recommendation, and Calhoun County Public Health Department supports this new quarantine and isolation guidance. Next slide. Masks. That's still a term that we want folks to continue to think about, and especially if you're thinking about yourself and you're concerned about your risk of contracting COVID. Maybe you care for somebody who's in that high age range or has severe underlying conditions, and it's important to you to not get COVID. Continue to wear a mask, and the best mask you can, the next slide is going to go over that. So this slide is just basically talking about, when should you wear a mask? Certainly if you're going to be in those high risk situations. And even if you don't fit in any of those categories, if you choose to wear a mask because maybe you have an underlying health condition, or like I said, a loved one that's close to you does, that's fine. We want folks to feel comfortable, and we want folks to be able to get out of their house and enjoy our community as well. And we want you to do that, and we want you to feel as safe as possible. Next slide. So how do you choose a mask? And I think this is really important, as we have found better quality masks that are now available to us. I think in the health department, we still have about 8,000 of the KN95s. And we've been able to hand those out to various places around the county. You can find a location for pickup there at the bottom of this slide, going to our website. But bottom line, you want a mask that fits over your mouth and nose. It needs to fit as tight or snug to your face as possible, and has good filtration. So the KN95 is probably the best choice for the general public to be able to wear. And this gives you a good illustration of recommended versus not recommended. And with that, I think that's it for me, Jessica.
Thank you, Eric. Lots of great information there for everyone. And we are going to turn it over to Kelly to start us off with a series of slides with spring break travel. Go ahead, Kelly.
Thank you, Jessica, and good afternoon, everyone. I also have good news, and that is spring is right around the corner, starts next week. And with some pretty basic guidance, travel this year can be an exciting and safe option, safer than it's been in the last couple of years for most people. So I like to kind of summarize the guidance high level, and then I'll go through a little more detail. But as Eric mentioned, the health officials are really stressing that you're in the best shape you can be to prepare for travel and any other activities if you're up to date on your vaccines. Having said that, it's really not that much different than living your life at home. And that is, you should understand if you might have COVID. If you do, you should find out. If you have COVID, you shouldn't be around other people. You should try not to give it to other people. And you should try to protect yourself if you're going somewhere that you might get COVID from other people. So having said that, the CDC does a pretty good job on their website of sort of an interactive way to assess what your risk is and what specific steps you will need to take if you're traveling this spring break. So really, even though we have some different guidance now based on the different community levels, the CDC is stressing that there is still one universal travel requirement in place, and that is there is a requirement to wear masks in all public transportation settings, so including airplanes and even in the airport. And then aside from that, we talked about they are recommending be up to speed with your vaccine, and then depends on where you're going. There are still a few higher risk places, and you can click on a map of the United States, for example, and see it county by county, state by state, what the community level is, so you know where you're going and what you're getting into. And then for sure, do not travel if you're sick. If you have just tested positive for COVID-19, then you should, follow the isolation guidance that Eric just mentioned. Or if, you're still in the middle of isolation, unfortunately, the guidance is to delay that travel until it's a better time. Right now, there's the very little requirement to quarantine, but if you're in that situation where you can't wear a mask or for whatever reason you're being advised to quarantine, then again, wait to travel till after that time period. And there are still some testing requirements, and particularly there are specific rules related to international travel. If you're going on a cruise, lucky you, the CDC continues to reduce the risk levels for the most part and is encouraging the cruise lines to opt into some COVID-19 safe travel programs. So that is an option now still, but if you're doing any of those things essentially outside of the United States or going on cruises, there are more specific rules around testing and vaccine proof. Next slide. So, again, the public health officials are still stressing that testing is an important part right now, even though we're in the recovery stage. The way to continue that is for us to figure out if we have COVID ourselves. And the US government is trying to make it easy in addition to our local health officials. And so we were originally able to order some home tests a couple of months ago. That has been increased now so that each household is eligible to order 2 sets of those. So there's 4 free tests in each one. And they typically can get to you within a week or 2. The website for that is covidtest.gov, and that is free. Next. And then as far as vaccines, because again, we're still saying that that's the best thing that we could do is to get the most people vaccinated. And there are still a lot of people that have questions about vaccines. The MDHHS has done a pretty good job of compiling frequently asked questions on their website. And there's some filters in there so that you can filter based on a certain profession that you're in or a certain setting that you're interested in. And then, so you can apply a bunch of filters to not have to sift through all of their frequently asked questions. But they talk a lot about, how safe is the vaccine and, should I get it in this situation, and how long should I wait in between? And, what about the ingredients and how long do they last? So a lot of questions there that I would encourage anybody who still has questions, or if you talk to your friends and family that are still hesitant to get vaccinated, this is kind of a nice place to send them first. And then in addition to the MDHHS FAQ, the Michigan.gov coronavirus site in general has some higher level information that they continue to update about COVID-19. So my final slide today is just to reassure all of you, because this is the purpose of this setting, is to make sure that our community has appropriate and relevant information from our unified command team. We will continue to be committed to messaging. And what our plan is, as long as we don't get worse as far as COVID data, we will continue, our leadership will continue to meet weekly. We will continue to monitor the data and to understand what's going on in our community and what communication needs that you all have. We will be switching to written community updates. So the JIC that we're doing right now live will be switched to a written update until there's a reason that we want to return to the live updates. And in order to sign up for those written updates, you can go to the county's website, calhouncountym.gov/COVID, and then click on Calhoun COVID-19 data and scroll to communications. So we are still here for you. We'll be here throughout the summer. And I think, as things continue to evolve, we hope in a very positive way, we will adjust our strategies accordingly. And that's it for me. Thank you.
Thank you so much, Kelly. Okay, so this is a new slide for this update. We're going to try something a little different today to try to make this update a little more efficient. So any elected officials or elected official representatives we have on the call today, if you have an update you'd like to share with the group, if you could please use the raise hand button here on Zoom, and we will call on you to give your update. All right, awesome. I see Karen Todd right away from Senator Bison's office. Karen, if you want to give us your update, that would be great.
Hi, everyone. Just very quickly, COVID-related news out of Lansing. Senator Bison introduced Senate Bill 925 about 2 weeks ago now, and it was referred to the Committee on Education and Career Readiness. It is a bill to establish a learning loss recovery grant program and to establish a learning loss recovery fund in the amount of $500 million. This bill would allow the parents of kindergarten through 12th grade students in public, private, charter, or homeschool settings to access grant funding to get tutoring or something similar of that sort for their student to enable them to catch up on their education that may have been lost during the pandemic. The bill is still in committee at this time. That's all I have. Thanks, Jessica.
Thank you so much for that updated information, Karen. Do we have any other elected officials at any level, local up through federal, or representatives on the line today who have an update to share with the group? Okay, I do not see any hands raised or anybody unmuted, so I think it is safe to move on. And once again, best information sources, especially as we go into a period of not coming back live right now. Make sure you get on the county, city, state, and CDC websites, all listed here for you. And of course, you can contact the three of us public information officers at any time if you have any questions or if you have any updates to share. And as we provide the written updates in the coming months, we will be reaching out to you as well for any updates that you have for us. And I believe that is the end of today's Joint Information Center. Thank you so much, everyone, for being here, and we will talk to you all soon.